Bismillahirrahmanirrahim. I welcome all of you in today's video, which is about the extraocular muscles. So there are MCQs regarding the mechanism of action of extraocular muscle. If we know the normal mechanism of the extraocular muscles, we will be able to solve these MCQs. So these are the controversial MCQs. A person while reading newspaper develops diplopia. A person while going downstairs, he develops diplopia. A person while reversing a car looks backward and he develops diplopia. Which muscle causes only horizontal diplopia, horizontal gaze palsy and tilting of the head? Now these are the MCQs that are repeating again and again, and there are MCQs like these MCQs, but we should know about the basic concepts behind these MCQs. So what types of movements are possible in the eye? Suppose I am having two eyes, adduction, abduction. I will not go into the detail, I am just revising all the things. Elevation, depression, intorsion, extorsion. So these are the basic movements which occur in the eyeball. So if we know which muscles and which nerves are doing these, we will be able to solve these MCQs. So muscles, how many muscles are there? There are 6 muscles: superior rectus, inferior rectus, medial rectus, lateral rectus, superior oblique and inferior oblique. Well, there are MCQs regarding these. These are very simple: SO4, LR6 and all other bicranial nerves. So the extraocular muscle are supplied by cranial nerve 3, except SO4, LR6, lateral rectus by 6th nerve and superior oblique by 4th nerve, that is the trochlear nerve. Now these two are very tricky. We will explain it in a while. Now here is the basic concept. When will we see the maximum action of extraocular muscle? Now the answer to this question is, if we look at the eyeball and if we look the axis of the muscle, the maximum action of muscle will be there if the longitudinal axis of the eyeball become parallel to the longitudinal axis of the muscle. When they become parallel, there will be maximum action of muscle. Suppose I am telling you, this is eyeball and the superior rectus is attached to the eyeball in this fashion. This is your orbit, this is eyeball and this is superior oblique. The superior oblique is not attached like this, it is making an angle. So the maximum action of superior oblique or superior rectus will be if the eye moves laterally. Now if it is contracting, it will cause elevation. Now it can cause elevation in the middle also, but that elevation is not maximum. The maximum action of this muscle will be only if this is the longitudinal axis of superior rectus and this is longitudinal axis of eyeball. So when they become parallel, there will be maximum action. So if the eye looks laterally, the axis of the eyeball and the muscle become parallel, there will be maximum action. Now this is very important, this concept, so that we are able to pick the MCQs. Now we will study the superior oblique. Superior oblique moves from the orbit, goes toward the trochlea, and then it comes back and attached to the eyeball in the superior posterior portion. Now if we see the axis of the eyeball is like this, while the axis of superior oblique is like this. So in order for the maximum oblique muscle to work maximally, the axis must be parallel, and that is only possible when the eye looks medially. When the eye looks medially, the longitudinal axis of the eyeball and that of the superior oblique muscle, they become parallel. When they become parallel, there will be maximum action. So when it contracts, there will be maximum action of the eyeball. Another MCQ regarding the tilting of the head, that is also very important. Now the superior oblique is the entorter of the eyeball. So it entorts the eyeball, it rotates the eyeball inward. So if these two are your eyeballs, this is superior oblique attached to this, what it does, it entorts the eyeball. So the entorsion of the eyeball is normally cancelled by the extorsion of eyeball. So normally the eyeball lies in the median position. There is no entorsion, there is no extorsion. Normally we do not tilt the head because the images are formed in the central. Now if a patient is having superior oblique muscle paralysis, what will happen to him? So the eyeballs look medially. Which muscle causes depression of eyeball? Superior oblique. It is attached like this. The axis become parallel. It causes depression of eyeball. Now if you are having weakness in this muscle, what will happen? The eye will fly away. The eye moves laterally. In lateral position, which muscle is causing depression? Inferior rectus. But medially, which muscle is causing depression? Superior oblique. So when the superior oblique is paralyzed, when the eyes move medially, it will fly away. So there is MCQ regarding this, that when you are checking a patient and while moving medially, his eyes moves upward. While moving medially, his eyes move upward. Which muscle is paralyzed? That is superior oblique. Now there is only one muscle in all the extraocular muscle which causes only single movement. That is abduction. And that is caused by abducen neuron. That's why it's called abducen neuron, because it causes abduction. So which nerve causes horizontal diplopia or horizontal gaze palsy? That is cranial nerve 6, abducen neuron. A person while reversing a car looks backward and develops diplopia. That is 6th cranial neuron. Because when a person reverses the car, he looks backward. This eye can move medially because this is caused by 3rd neuron. But this eye cannot look laterally. 6th neuron is paralyzed, so he develops diplopia. A person while going downstairs develops diplopia. Now we know that the strongest depressor of eyeball is superior oblique. When the superior oblique is paralyzed, there will be diplopia while looking downward. And when the person is going downstairs, of course he looks downward. So while looking downward, his eye will not be depressed, and if his eye is not depressed, it is flying away. If it is flying away, he is developed diplopia. A person while reading newspaper, again the same MCQs, he will develop diplopia.